Hi, everybody. Welcome back. It's Dr. B with Addiction Recovery. As those of you that are with us regularly know, this channel is about all things substance abuse. We try to take the scientific and clinical evidence. We marry it up with clinical experience. We formulate and digest it in a way that you can process it very easily, whether you're the substance abuse patient, whether your family loved ones, the public at large, or hopefully policymakers. We want to take out some of the mystery, introduce formal thinking so you can make really, really good decisions about your personal and the public's outcome at large. Today's topic, I want to revisit coronavirus and the COVID-19 pandemic. I think it's a good time. If you haven't seen it, this is in reference to the video I made in March. Given the number of cases that we have thus far worldwide, it was clear 1 week ago that this was going to be a pandemic. 40 to 70% of the world's population will be infected. The ones that are at highest risk seem to be the elderly, those with suffering with chronic disease and that are immunocompromised disease. Flattening the curve, when you see all of the public health measures that are being taken that really flatten the curve, it's called social distancing. You might see some of that in the media and people talking about it. Don't touch your mouth. Don't touch your face. Don't touch your eyes. Washing your hands often. And that really means to get your hand under the sink, use soap, use warm water, and spend at least 45 seconds to 1 minute. Whatever your local circumstances are, try and stay as clean as possible yourself. Take some of these measures that I've told you, such as hand washing, basic hygiene, social distancing. Take these very seriously. Try to stay very well hydrated. Try to keep your nutritional status high and let this thing pass. Everything that I said in there, including the fact that I was concerned about our social, political, and institutional response to this pandemic, which is going to make it worse, and that's exactly what has happened. But there's a lot of good information in there, including statistics and some guidelines, including social distancing, sheltering in place, washing hands, and general guidelines and outcome and data, and it's about the position I have on the substance abuse community. Today, November, I believe 23rd, 2020, I'm in Orange County, California, and things have really gone exactly as expected, and they're pretty bad, and they're kind of putting in some shelter orders again pretty soon, I think, which it's really, like I said, to me, it's the way it would have gone given the way we were behaving with this virus. I think it's an opportune time to bring up some issues. There's some projected data and numbers on there. Projected deaths of despair by the, I think, Wellbeing Trust Foundation nonprofit. They're looking at 75,000 deaths secondary to suicide, the depression, alcohol, and substance abuse over the next several years, secondary to the pandemic. Okay, so that kind of shows that this population is a bit more vulnerable. In addition, if you go through the list, by virtue of having a chronic disease, that increases your risk of exposure, worse outcomes, and potentially death. But this particular disease also comes with anxiety, depression, and a whole host of social factors: poverty, crowded housing, exposures out in public, jail time, prison time, a whole bunch of things, unemployment, that make exposure much more likely and the outcome much more likely. Just gonna have to trust me on why that is the case. But I want to sort of discuss this. I don't want to create panic. I don't want to create anxiety. I want to look at the silver lining in all of this. And there is a silver lining in everything. Most of you are very used to challenges in this world and coming up against walls, and somehow you're resilient and you make it through. This is a challenge that is affecting everybody, and you are a population that are much more vulnerable to the negative impact and outcomes from this pandemic. But I want to challenge you to look at it in a different way, okay? Don't get panicked. Don't get scared. Don't lock yourself in and increase your use. Let's keep that 75,000 number down. Here's what I have to tell you, okay? Number one, there's an opportunity here, okay? Because of this pandemic and this virus, this is a very, very, very first kind of time since this virus broke out. You as a substance abuse patient or client can access care, a lot of care that you couldn't before through telemedicine, okay? That is a wonderful opportunity and gift for you to get care. Everything from counseling, mental health, to medication-assisted treatment. And I hope this stays around for a while. That is a huge opportunity for you to take advantage of, okay? In addition, there appears to be, and I don't promise this, a lot of federal and state and local fundings in terms of grants and all kinds of federal money, possibly down the pipeline, many happening at this time that directly address your needs, which means more expansion of services, okay? So I want to challenge you, as much as you are more vulnerable to the devastating effects of this pandemic, both at the health level, individual level, psychological and mental health level, emotional level, social level, financial level, institutional level, I think I really am challenging you to rise to the occasion, stand up. Many of you have gone through much worse, seen much worse, and taken much worse. You know what? Now I'm going to tell you to try something different. Take a situation and utilize it to grow. And maybe, as crazy as it sounds, I think many of you can take this, stand up, and promote your own recovery, sometimes even for the first time for many of you. Okay? So keep washing your hands. Exercise social distancing. Concentrate on today and what needs to be done. But don't forget about tomorrow. I'm not telling you to completely push it off, but don't become anxiety-ridden or depressed about it. Let's not contribute to the projected 75,000 number. Go back to my first video and exercise all of those things. Like I said, social distancing, hand washing, staying in place, okay? Minimizing your risk of contact and exposure. Take the opportunities presented to you now and utilize it to achieve maybe sometimes first-time initial recovery and hopefully long-lasting recovery. If you want to know more about this topic, please click on the videos above to the left. If you enjoyed and liked this video, please subscribe. Please click the bell. I know many of you can do really well through this thing. The holiday seasons are coming up. That is a difficult time for this community. Again, I'm going to ask you to rise to the challenge and utilize the opportunities presented to you to achieve better mental health, better recovery, and sometimes that means first-time recovery. And again, the suicide prevention hotlines, the substance abuse relapse community that is out there for reaching out for help, it's all in full effect, better than ever, so utilize it. Thank you very much. See you guys next time. Good luck.